Hi, my name is Dr. Bianca Clark, and welcome to Form Meets Function. We're going to do a deep dive today into the restorative dentistry applications with LuxCreo 4D workflow and using digital workflows to allow us to be able to provide our patients restorative options. Once again, my name is Dr. Bianca Clark. I am a general dentist and co-owner of West Loop and Hyde Park Smile Studio, located in Chicago, Illinois. I have over 13 years of clinical dentistry practice and 4 years of academic dentistry with Harlem Hospital. And what started my journey into the digital design realm was the opportunity that I had to take courses at the Mod Institute. If any of you have an opportunity to take any courses with the Mod Institute or with Dr. John Kois or even Dr. Matt Nahad, it's an incredible opportunity to expand your clinical skill set as a dentist. But with the Mod Institute, I was able to grasp the tools that I needed to be able to function within the digital design realm, particularly with restorative and removable options. Dr. John Kois, the Kois Center in Seattle, helped me foundationally to be able to understand and implement not only design principles, but the principles behind superior occlusion. And Dr. Matt Nahad of the Nahad Institute is world renowned for his instructions on how to navigate the biomimetic realm. I am a huge advocate of including not only biomimetic dentistry in your clinical workflow, but also expanding your digital footprint in regards to your workflow and the opportunities that you have to provide same-day digital dentistry to your patient population. I want to take this opportunity to thank LuxCreo for this opportunity. They are a company who is a leader in 3D printing, and they truly believe in the vision of their company, which is a vision that envisions a world where doctors are empowered to deliver personalized, high-quality care. They accomplish this through their support methods in 3D printing, as well as their seamless workflow integration in the digital landscape. With this webinar, there are a few objectives that I hope that we can all leave today with. We will have a brief review of some of the biomimetic principles that I follow in my practice with my patients. We will do an exploration of the LuxCreo 4D workflow, and I will also be evaluating with you all some real-time clinical applications when it comes to incorporating digital dentistry and the LuxCreo 4D workflow with the 3D printer. I hope that each of you will be able to learn some of the ways that you can implement this into your own workflow and practice with your patient population. And we will round out this conversation with a brief overview of the ROI associated with incorporating digital workflows and 3D printing in your private offices. There are a few issues that we face with conventional dentistry, and everyone here knows what this is. This is a conventional impression with PVS, and the ways that we work with our traditional methods kind of create a sensory overload for a lot of our patients. The sights, the smells, and the sounds associated with conventional dentistry can be quite anxiety-inducing for our patients. So the opportunity to divest from those types of workflows are truly advantageous for us as providers because it opens up an avenue for us to be able to provide our patients the opportunity to kind of step away from some of the areas where patients traditionally have had some apprehension for moving forward with dentistry. And our conventional methods, though they do have success rates, they also have really high failure rates. And some of the reasons behind those failure rates are because we are unable to remove the human element from those types of processes. And as we all know, dentistry is called the practice of dentistry for a reason. We're always improving and learning. And part of that journey should be for all of us to incorporate digital dentistry into our practices to help eliminate some of the pitfalls that we see with traditional dentistry. So where are these workflow challenges? Part of them are that traditional dentistry can be time consuming. We can find ourselves being victims of inconsistent outcomes. And for me, one of the largest reasons why I wanted to incorporate digital dentistry in my practice was that I found with these traditional workflows, there creates an environment of limited patient engagement. So with traditional workflows, those appointments kind of create an environment where multiple visits are built into the model. If you include delays from the lab, turnaround times, if there are any delays in shipping, if there are any issues with remakes or adjustments, we end up really extending the amount of time that patients have to spend in our chair that is not valuable time. And we consider that lost chair time because it creates appointments that don't have any productive value. And they also, unfortunately, have the opportunity to cast doubt in our patients' eyes and our abilities as a clinician. Inconsistent outcomes are a very big issue associated with our traditional workflows. And part of that is because our outcomes as clinicians really depend on our variability and our skill set. And each of us do not come to the table with the same level of skill sets. Some of us have stronger restorative inclinations. Some of us have stronger prosthodontic inclinations and endodontic, as well as orthodontic inclinations. So removing the obstacles that we have in regards to being able to see our patients in a broad scope is really one of the greatest advantages of digital design and digital workflow. We are removing conventional impressions. We are also removing inconsistencies that are created due to technique-sensitive variables. Lab communication also increases the risk of inconsistent outcomes. Your models can distort, they can break in transit, and oftentimes there is a discrepancy between what the lab technician reads as our margins and what we clinically have created. Errors in shade, fit, and occlusion can also create appointments that are unproductive and devalue the commitment that we have to our patients. Now, for me, once again, limited patient engagement was one of the largest reasons why digital dentistry was extremely important for me to incorporate into my practice. And what limited patient engagement looks like is an invisibility of how we work. Traditional workflows can be extremely opaque for our patients. They come in, they have their tooth drilled, and they leave. And that is not a transparent process. And patients can oftentimes be left to feel like they're just passengers or passive recipients and not truly active participants in their care. This also creates a limit in the educational opportunities that we have for patients. The traditional workflows that we have offer few built-in opportunities for us to be able to engage our patients in their care and understanding orally what is exactly present. Patients lose the ability to see digital scans. They can't see the CAD design, and they also leave with a loss of engagement when they are not involved in their own care narrative. So how do we circumvent this? For me, the solution to that was to incorporate digital workflow into my practice that would allow me to have control over the solutions that I provided my patients from start to finish. We've all been here where we have had a clinical failure, but part of what makes us successful is being able to evaluate where our failures occurred and navigating how to prevent those from occurring in the future. Digital dentistry is an extremely valuable tool that helps you to be able to evaluate your systems and the processes that you use to be able to deliver solutions to your patients. So let's get a little bit into conventional versus biomimetic. For me, when you think of conventional dentistry, and most lay people will think of a conventional dental technique as just filling a hole. But as we all know as clinicians, dentistry is way more than that. It's about rebuilding a living structure that absorbs functional forces over time. So for me, biomimetic dentistry really encompassed that idea. The idea that through conservative dentistry and adhesive dentistry, we can practice in a way that is additive for our patients versus reductive. And that's not to say that there is not a place for conventional dentistry, but as we see our patients begin to age with full dentition, taking a step away from really providing full coverage in all areas of dentistry, like I said, allows us to practice additively versus reductively. And, we really do our patients a disservice when we provide full coverage when conservative options were available to them. So why biomimetic dentistry? Again, this is an opportunity to be able to do conservative dentistry for our patients with the goal of decreasing fracture risk and enhancing tooth longevity for our patient population. So biomimetic dentistry, though it sounds like a really big word and sounds really complicated, really operates on three basic principles. And those principles are to preserve, to mimic, and protect. We preserve tooth structure by offering our patients minimally invasive approaches, as well as providing tooth reductions that are conservative. We rely on adhesive bonding versus resistance form or retention form to retain any type of prosthesis that we are delivering to our patient. We want to create natural mimicking restorations so that we can ensure that we are distributing their occlusal forces naturally. We want to mimic the flexibility that dentin provides us and the hardness that enamel provides us, and not incorporating inorganic feelings and inorganic opportunities for contacts that are uncomfortable for patients by recreating things that don't really exist. We are also wanting to reduce stress that we place on our teeth. And again, we do this by recreating natural occlusal forces. We want to enhance pulp vitality and ensure longevity and durability of not only our prosthesis, but of our patient's dentition. So let's get into some of the protocols with biomimetic dentistry. And biomimetic dentistry is not really about the materials we use, but the processes that we use to, once again, preserve, protect, and mimic. We do this by creating indirect and direct restorations that preserve enamel, because we know that that's going to create the strongest possible adhesive interface for us. When we are doing direct restorations, we're going to be using layering techniques to ensure that there is a prevention of sensitivity as well as shrinkage of those restorations. When indicated, we're going to use fiber to reinforce any teeth that may have been cracked or damaged due to occlusal forces. We're going to use dentin mimicking composites so that we can make sure that we are recreating the flexibility that naturally exists in our teeth. We are also going to be using immediate dentin sealing to prevent sensitivity and improve bond strength between our tooth and our restoration. Resin coating where applicable, but ultimately using materials that are biocompatible and using design that is biocompatible while also being conservative. So let's go over some of the biomimetic prep techniques. And once again, this is a very simple process. We're not here to reinvent the wheel, but we are here to encourage the use of a caries-driven preparation technique. And so what that means in the simplest of terms is using caries indicating dye to guide the amount of tooth structure that's actually removed, because ultimately we want to maintain healthy tooth structure. We want most of the tooth to still be present once we finish our design. We're going to reduce stress in the tooth by including fiber reinforcement when needed, and we're going to immediately seal the dentin to increase the bond strength between our tooth and our restoration. So why digital design and why 4D dentistry? 4D dentistry and digital workflow allows us to create a customized solution for our patient. It is tailor-made and bespoke for our patient for their particular needs. And it's a dynamic process. It encompasses time and allows us to be able to create solutions for our patients that are same day and they are definitive. And these are also integrated workflows. These workflows work with a variety of systems that don't mean that we have to reinvest in a multitude of software programs or, have new computers. We can really truly seamlessly integrate these workflows into the ecosystem that we have already created. We will be using CAD/CAM technology. And once again, just kind of going back to when I spoke earlier about removing one of the largest pitfalls of dentistry, and that's human error. CAD/CAM technology provides us a unique opportunity to evaluate our workflows and to evaluate our own skill set to improve in real time, which is extremely valuable for our patients and extremely valuable for the longevity of our own dentistry. End to end, this is a dentist and team workflow that completely makes this process seamless and allows you as the dentist to be able to be as hands-on or as hands-off as you choose. Once you have the patient in the chair, the clinical team member can scan the patient. For whatever your restorative option is, you have the ability to either outsource that design or design it in-house using exocad, 3Shape, or Medit software, because each of those, as I said again, can seamlessly integrate into your own systems. And then utilizing the LuxCreo 3D printer, you print your patient's prosthesis and deliver to the patient same day. So we've created a workflow where we are able to serve our patients solutions that are viable solutions. They are same-day solutions, and they really open up the door for us to be able to educate our patients about not only their oral health care, but how far dentistry has come in regards to the digital realm. So for me, digital design is an opportunity for me to evaluate my workflow and evaluate my clinical skill set. I truly use digital dentistry to sit with myself and see what design principles I need to improve upon. I also use digital dentistry to create checkpoints for when I do have my patient in the chair. If I see something digitally that I know is going to create an unsuccessful outcome, I can very easily go back to my patient, adjust and rescan. And that creates such a unique opportunity for us as clinicians to give ourselves a sort of fail-safe system. We have the chance to immediately stop in our tracks if we see that something is going to be unsuccessful, adjust, and still successfully be able to treat our patient same day. So again, some of the advantages of a 4D workflow include a faster delivery. We're not waiting for a lab to create a prosthesis for us and deliver it to our patient. We can predict the fit and the aesthetics because start to finish, those are in our hands. We know that something is going to work for our patients. We know that it's going to fit, and we know what the aesthetic outcome is going to be because we've had complete control over that process. 4D workflow provides us a wonderful opportunity for clinical precision. The digital workflows, once incorporated, will give you feedback on your processes and will give you feedback on your preparations. So all you really truly have to do is allow the digital CAD/CAM technology to help you be a better clinician. We also see an improved patient satisfaction because we are eliminating patients' need to return to the office to complete treatment. And especially in the world that we live in today, patients want things immediately. They want definitive solutions. They don't want to have to return to the office multiple times. And once again, that just really chips away at the success that we have in continuing a positive relationship with our patients when we have to contend with multiple remakes, multiple shade issues, or multiple fit issues. 4D workflow also allows us to be very efficient with our time. Not every aspect of this has to be done by you, the clinician. This can be outsourced, as I stated earlier, and this can also be delegated to your team members. You can teach your team members how to design if you choose. You can teach your team members how to scan effectively. So that frees up time for you to be able to pursue other options clinically. You have the ability to work out of multiple rooms because your team is going to support you in that workflow. Regarding the software that I discussed earlier, Lux Design CAD provides an amazingly flexible design platform. We will talk about that a little bit later, what that flexibility looks like. But with the seamless integration that LuxFlow provides, we then can use Lux Design to create whatever prosthesis is applicable in that situation. LuxFlow also has a very simple one-click system that once again, can be outsourced to your clinical team if you choose to. But that one-click system allows for generation of the supports that are needed to be able to successfully print whatever it is that you would like to print for your patient. So once again, we're removing human error. We know that our print is going to be successful for our patient because we've had complete control over that system. We've had the help of 4D workflow to help make that seamless and to help make that error-proof. So again, regarding the one-click workflow, it allows us the opportunity to create time efficiency by generating the supports that we need in any of our nested restorative options that we provide our patients. So it eliminates the issues that can arise when we are having to move around multiple supports, when we're having to play around with nesting when it comes to our 3D prints, and once again can foster an environment of positive patient experience by just making sure that we're able to stay efficient with the time that we have with our patients. The resins that we use are extremely versatile resins. They encompass a system that is compatible with our natural tooth structure, and they have a multitude of indications, such as inlays, onlays, if you are an implant-based practice, all on X, crowns, and veneers. The resins are biocompatible, they're strong, and they are highly aesthetic. Sculpture 2.0 that you see here is one of the only zirconia-infused nanohybrid resins available on the market. Sculpture is a Class 2 ceramic nanohybrid that has beautiful polishability, and Titan is another Class 2 ceramic nanohybrid that's utilized for all-on-X prosthetics. Each of these opportunities that we have to provide same-day solutions not only create natural results, but beautiful results that can be definitive depending on the patient's circumstances. Now, again, this workflow, start to finish, in your own hands. If you choose to do your own digital design, wonderful. If you choose not to and your assistant does it, great. You design in CAD or you outsource the design. Either option is available to you because, once again, all of these systems work together. You're going to print, you're going to process, you're going to try in, and you're going to deliver. And that's just, again, a wonderful opportunity not only to provide a same-day solution for your patient, but if there is any failure along this pathway, you have flexible predictability that allows you to revisit where you may want to adjust so that you can create a successful clinical outcome for your patient. One of the areas where I truly love to use my digital workflow and my 3D printer is when it comes to restorations for my patients. Again, because I believe in conservative dentistry, I always try and ensure that I'm providing my patients a lasting result that allows them to function mostly on their natural dentition. So in this picture above, we have tooth number 2 that has a large amount of decay present. And a little bit later on, we will get into a more in-depth analysis of what this workflow looks like. But the picture underneath, what I really truly want you to appreciate is that we have recreated what was present. There really isn't much difference between the aesthetic appearance of the patient's natural tooth in the picture above and the aesthetic appearance of the picture below. We see a very natural looking restoration that is supported mostly by the patient's natural tooth. And that's what you want. You want something that recreates the initial environment that the patient existed in, but also restores them to form and function. The preoperative photo does not have tooth number 15 in it, but tooth number 15 also received a printed inlay with Sculpture 2.0. And again, what we see here is a natural, lifelike prosthesis for the patient that the patient received same day and was restored to function and able to leave the office in an efficient amount of time and only came back for follow-ups. And these hold up extremely well and look beautiful even 6 months later to a year later. And again, these end-to-end systems really just work, but they only work if you take full advantage of them. And what that means is incorporating them into the systems that you have in place. You don't have to completely destroy the systems that you already have, but using digital workflows to enhance what you have and make you a better provider for your patients. So let's go over a little bit of a digital inlay case study. And for me, inlays and restorations that are 3D printed using digital design allowed me to create a simple prosthesis for my patient, create better clinical outcomes for myself, and allowed me some growth and profit. So we have a case here, and this is a patient that has multiple failing existing composite restorations. This is a patient that comes to her dental visits regularly. She has great oral health care. Her oral biome is healthy enough to support restorations being successful. And she and I had multiple conversations about some of these failing restorations. And, her experience with composites had not been a positive one. She had had these restorations done multiple times in the past. And like I said before, when patients are left out of their health care, it really creates a disparity between their understanding and education, as well as a large gap in their ability to be able to see us as providers that can restore them to health. We kind of become the enemy in that regard, and you become the dentist that did all these fillings, and now all of my teeth are either crumbling apart or all my fillings are falling apart. Digital dentistry gives us the opportunity to reframe that narrative. And once again, she and I had this conversation about these multiple failing composites. And initially, her response to me was, I'm not ready. And she wasn't ready because she had had these fillings done before. She already had been discouraged by having multiple restorative treatments done on the same teeth. When I reviewed with her what the digital process looked like, she decided that she would give this an opportunity, which I think is a huge win for us as providers when we can encourage patients to treatment in a way that educates them. I removed the composites that were present. And again, you can't see tooth number 15 on this photo. But after removing the composites that were present and failing and using caries indicating dye to make sure all of the decay was removed, you will see underneath there some inflamed gingiva. But there's not a lot of bleeding. And what that says to me is that this is a patient that can take care of her oral hygiene and can take care of her oral health, but she just needs the tools to be able to allow that to happen. And I can't speak to the provider that she saw that did the work, but what I can speak to is that I use digital dentistry to help me to become a better clinician. And I hope that that is where we all go in the future. The treatment that I provided this patient was that I 3D printed inlays for the larger restorations that she wanted to move forward with. So again, I removed the defective restorations, removed the recurrent decay that was present using caries indicating dye, and I created minimal preparations that were super gingival. They were above the gum line. And I always take photos of my cases because, once again, if you are not using digital dentistry, photos is another way to be able to make sure that you have all of the tools that you need to be successful. But ideally, you're using 3D workflows and digital dentistry because it allows you to work in real time. So with removing the restorations that were present, this is a minimal preparation. This patient still has a lot of her natural tooth structure. And ultimately, that's important because we don't want to create an environment where we encourage failures of the patient's dentition or failures of the restorative complex. So regarding the instruments that I do use, though this is not a photo of a fine diamond, I only use fine or superfine diamonds because as research tells us, fine diamonds and superfine diamonds really create a superb bond between the resin and tooth structure interface. So I'm going to be using usually about an 016 tapered diamond to create that form that I need to be conservative, but to also allow for ease of seat of my restoration, because keep in mind, this is going to be 3D printed. It has to be delivered. So I really want to make sure that I can successfully deliver my 3D print by making sure that my angles are rounded and by making sure that my walls are divergent. I don't want to close myself in. I want to conservatively open up that preparation. After I complete my preparation, I'm going to immediately dent and seal. I'm either going to DBA or I'm going to use resin coating. DBA just stands for dental bonding adhesives. To create a superior bond between my tooth, my restoration, and my adhesive. What I also love about the resins is, again, in your hands, you have the flexibility to do as little or as much design, but also as little or as much when it comes to staining and glazing, and really truly characterizing the aesthetics of your restorations. Rodent has an into-free glaze that allows you to stain and glaze your restorations without having to use auto flash or nitrogen to adhere the stains and glazes to your print. You can successfully stain and glaze without adding additional equipment to your systems. And these just really truly create a beautiful opportunity to provide your patient a natural looking restoration. And this is the final print. Tooth number 13 was stained and glazed. Tooth number 12 was only glazed. And what I want you to appreciate here is that the interface between the tooth and the restoration is seamless. You truly cannot tell where the tooth and the restoration begin and end. And that's what you want. I took this picture and I showed it to my patient, and she was floored when she saw the difference between the right side restorations that were directly placed and are extremely large and are also on the list of replacement because they all have recurrent caries. And what we were able to successfully 3D print for her today which were restorations that we know will have a superior bond and restorations that allowed us to be able to conserve her tooth structure. Now, how do we deliver these for our patient? Because these are going to be adhesively bonded to the teeth, we want to make sure that we're using traditional adhesive dual cure or self-adhesive cements. We're going to treat this as any other indirect restoration, and we're going to microabrade it. From there, we're going to treat the intaglio as a zirconia crown. We're going to use IvoClean. We're going to clean it off, and then I'm going to selectively etch and bond my teeth. I'm going to use a two-step system to provide adhesion between my tooth and my restoration, and then I'm going to fully seat them. I personally like to use the GSIM-1 system, but you can successfully use any self-curing resin adhesive system that you have in your office. I like GSIM-1, again, as I said, but you are not restricted to any type of adhesive system. As long as you're following the biomimetic principles that we've discussed earlier, making sure that these are isolated very well, making sure that you are delivering them in a dry and isolated environment, you can successfully deliver your 3D print. Post-treatment, we're going to evaluate the occlusion and we're going to polish. And it's that simple. We're going to adjust occlusion with carbide burrs if we need to and polish with composite polishers. But because we are digitally designing these, we very rarely have to do any adjustments to occlusion. I typically only have to adjust the occlusion if I've been a little generous with the staining. But for the most part, these sit precisely in the teeth and the occlusion is always spot on. And I, to this day, have yet to have a patient come back for an occlusal adjustment. But part of that is because I've removed human error. So my typical inlay-onlay workflow is pretty streamlined. And I keep it streamlined because that allows me to be successful. My team knows this process start to finish. They know how to process the prints start to finish, and they can successfully schedule these appointments so that we are effectively using the time we have available with our patients. Some of the prep guidelines that I always adhere to, making sure that you can see all aspects of your tooth preparation, making sure that the walls are rounded, making sure the margins are supragingival, making sure the walls are divergent, will create an environment where you can have a successful seating of your print. The scanner. I love my scanner because once again, it provides me the opportunity to check my own work, and that's important. Because I always want to make sure, one, that my print is successful for my patient, but if I notice any errors in my preparation, I can adjust them and rescan. So why is same-day delivery so important? It's important because we want to make sure that we're working efficiently. We want to make sure that we're using our time wisely because part of the dental experience for our patients is not only providing them successful treatment outcomes, but also being a system of support for them when they have questions or when they need to be educated. The aesthetic flexibility of 3D printing in your office is an opportunity for you to do as little or as much with the stains and glazes that we reviewed earlier, but you have the opportunity to create natural restorations that your patients will find fit seamlessly and flow seamlessly between the restoration and the tooth. Same-day delivery also allows us to practice conservative restorative options because we know that we're not having to contend with adjusting the tooth structure based on the material. The resins can be printed very thin. So once again, we can maintain those conservative design principles that we know will not only serve us well, but will serve our patients well in the long run in maintaining their oral health. And ultimately, what do we want? We want an amazing patient experience because we want our patients to come back. We want to be able to evaluate our work, but we also want to create a positive patient experience because we want to be successful. We want our patients to leave our chair and tell their friends and family that they go to a dentist that is committed to technology, committed to excellence, and committed to providing them same-day definitive solutions that work and allow them to keep a majority of their tooth structure. That is extremely important to patients, especially in the age that we live in, where information is available at their fingertips. Patients will often come to me and ask me about 3D printing, which is a complete turn from the environment that used to exist when patients knew nothing about 3D dentistry. So as our patients' dental IQ increases, we want to make sure that we do ourselves a service as clinicians and stay abreast of the latest technology and stay aware of current treatment methodologies. So here's another case. This was a patient that I saw who had a large crack in tooth number 14. Now, we removed the restoration that was present in this tooth. It was an amalgam. And as you can see, there's a pretty extensive crack along the buccal surface of the tooth. The tooth had no symptoms other than the visible crack. And after explaining to the patient and taking intraoral photos, once again, using digital workflow, took a scan, took photos, and educated the patient on what was present. And that really encouraged the patient to move forward with treatment. This patient, unfortunately, is already missing multiple teeth. So maintaining the dentition that she has was extremely important to this patient. And we sat down and had a conversation about what we thought would work in the best interest of this patient. And crowns really were not an option for this patient due to limited finances. And patient also had an apprehension to crowning her tooth because she had a negative experience with crowns in the past that resulted in tooth loss. And even with biomimetic principles, it is an option to present our patients with biomimetic options that, though they may be within the wheelhouse of conventional dentistry, they can still be approached in a conservative manner. For this patient, we decided to move forward with a 3D printed onlay design. Now, what that process looked like is really truly evaluating what was left after we removed what we knew we could not preserve. In the crack that was present, we fiber reinforced that utilizing Everex, and then followed along with the biomimetic design principles that I reviewed earlier, making sure that I had divergent walls, making sure to conserve as much tooth structure as possible, because I still wanted this patient to ultimately be occluding naturally on her tooth structure. Once this was scanned, I then designed, printed, stained, glazed, and delivered this prosthesis for this patient. And this is about 10 months post-delivery. And what we can see is that this patient still has great use of her natural tooth. She still has two very large walls present on the buccal and lingual. And what you cannot see in this photo is that the distal extension of this preparation is not even halfway down the axial wall. This very minimally goes to the distal of this tooth. And what we've been able to provide this patient is a solution, a same-day solution that still falls in line with the ideals that the patient presented with. Some of her non-negotiables were that she was not prepared for a crown, but that did not mean the tooth didn't need treatment. So by providing her a restoration that maintained her natural tooth structure, I was able to meet the patient where she was. And that's a successful case for me because the patient is ultimately happy and the tooth is restored. Again, following along with our design principles of making sure that we don't have any undercuts, making sure that we have rounded line angles is ultimately important for this success. One of the ways in which I also use digital dentistry in my practice is to show patients what someone else's case looked like. Obviously protecting patients' privacy, but showing patients how they are not unique in their need for dentistry and how 3D printing can be a safe solution for them. With this photo, I want to illustrate how I use 3D digital design to take a step back and see where I need to adjust. Everywhere where you see that reddish hue is an undercut. That's something that is unacceptable in my design. So for this patient, I simply went back to the patient chair, adjusted my design, and rescanned. Now, had I not been utilizing digital dentistry and a digital workflow in my practice, I would have missed that opportunity to see where my design needed help. I would have moved forward with this case and probably would have spent an enormous amount of time adjusting this restoration to get it to seat properly. But because I'm using my digital design workflow and my digital workflow to check my own dentistry and create stop points for myself, I'm able to successfully be able to ensure that my prints are great for my patients. On the upper right here, excuse the photo, but this is a 3D printed onlay that I completed for the patient. And this is a nice, beautiful, lifelike restoration. And this will serve this patient well. The patient still has a majority of their tooth structure present, and their occlusion is wonderful. It's perfect because I've digitally designed the occlusion to fit the way that the patient naturally closes. We don't want to create an environment where patient has contacts that are uncomfortable for patients because we know that's a patient that's going to come back and need an adjustment once a week. That patient is going to have pain when they chew. That patient's going to have pain when they function. But using digital workflow, you're almost able to completely eliminate the need for multiple appointments for occlusal adjustments. And as you can see on the lower right, you have the opportunity to print multiple restorations at once. How valuable is it that we can have a patient that might need anywhere between 8 to 10 restorations, and we can successfully print and deliver them in one sitting and not have to contend with multiple appointments for this patient? The patient doesn't have to leave in temporaries. They don't have to adjust the way that they function because they have multiple temporaries. And the patient can move on successfully with their life without losing any amount of sleep over whether or not their tooth will be healthy under the temporary or if their gums will be healthy. Temporaries can really truly be a site of aggregation for bacteria. We've eliminated that. So we've also created an environment where we are encouraging gum health by encouraging digital workflows that allow us to deliver same-day dentistry. So what materials am I using for 3D prints? I really truly enjoy using the Rodent Sculpture 2.0 system for printing inlays and onlays for my patients. Part of the reason why this resin is extremely valuable for me is that it has a marriage of mechanical strength, biocompatibility, and aesthetics. This resin is radiopaque on X-rays, and it also has ADA approval because of its zirconia infiltration. And these are an example of two inlays that I printed. And these inlays look like teeth. They're very natural. The staining looks very natural, and these simply have to be delivered, adhesively bonded to the tooth, and polished. That's a win for myself, that's a win for my team, and a win for my patients. I would not be able to successfully complete this workflow without digital dentistry, without LuxCreo's 4D workflow, and without my 3D printer. This is not something that you're going to be able to achieve utilizing indirect lab techniques. So let's talk a little bit about how 3D printing and utilizing LuxCreo's 4D workflow has increased my ROI and increased practice growth for me. One, I've decreased lab costs because I'm able to 3D print in-house a majority of the prosthetics that I create for my patients. I have a higher case acceptance because I can tell a patient that they can successfully start their treatment and finish it the same day. I'm creating a positive patient experience because, once again, I'm creating for my patient same-day options and opportunities, and I'm eliminating the anxiety that comes along with being unsure with what's been seated in your mouth intraorally when it comes to temporaries. So, time-saving procedures for patients. And ultimately, this results in a higher treatment acceptance for me. Now, regarding the fees, the office that I co-own is an insurance-based practice. While we do have fee-for-service, a majority of our patients are served utilizing dental insurance. So with that being said, for inlays, the fees typically range anywhere between $600 to $800. Now, the benefit of doing multiple same-day restorations is that you have an expansive opportunity for ROI when you invest in 3D printing and digital design and workflow because you are delivering this same day. Now, if you are doing multiple cases per week, there is a huge growth opportunity in your production. And as far as the cost for resins, They are extremely affordable when you look at what it costs you per prosthesis. So if I'm printing a 3D printed inlay or onlay, that's going to cost me about $5.36, depending on the size of the print. That is an amazing ROI when you implement digital systems and 3D printing into your practice. And I've also created an opportunity for patients to go out into the world and tell their family members and their friends that they are seeing a practice that is technologically advanced and is able to treat them in a conservative biomimetic way that allows them to start to finish, be able to successfully finish treatment. Now, I've spoken a little bit about the fixed applications of 3D printing, but with the LuxCreo 4D workflow and the LuxCreo printer, there are also several removable applications that can serve you as a practitioner. The opportunity for full dentures, partials, all-on-X, retainers, aligners, night guards and splints, deprogrammers if you are familiar with the COIS guidelines, surgical guides, injection molding, sleep appliances, and gingival reduction guides exist. And if anyone ever asks me about my journey with 3D printing, most of my patient population is restorative. So the restorative aspect of 3D printing was most attractive for me. But regardless of what your patient population is, you can see that you can serve your patients wherever they are. You have such predictability and such flexibility that you can truly use your 3D printer and digital design and digital workflow to successfully treat your patients in whatever their treatment indications call for. And again, endo, cosmetic dentistry, biomimetic dentistry, hygiene, perio, ortho. There is not one aspect of dentistry that cannot be touched by 3D dentistry and a digital workflow to enhance the opportunities to treat our patients. Because of the variety of indications that are supported, you have the opportunity to practice as a clinician how you see fit. And you can also use these as educational opportunities for your patients in whatever dental space that you occupy. Here's an example of how you can utilize LuxCreo's design services to really truly tailor what you would like to print for your patient's needs. There's a multitude of opportunities here for you to be able to treat your patients start to finish. The interface for patient design, super easy, it's simplistic. And again, this is an opportunity to show your patients not only what exists intraorally, but how you will restore them to function. We've removed human error, we've created stop points for ourselves, and we've created educational opportunities. And this is truly the power of using digital workflows in our offices. So if you are an office that is very implant heavy or an office that's very removable heavy, maybe the removable side of 3D printing is where you would find your greatest advantage. So let's say you have a patient that is in simple need of a flipper in preparation for an implant. Whatever your fee may be, the cost to fabricate a 3D printed flipper or Nesbit is roughly $13. And if you're charging more than $13, you can see how this design workflow allows you to have an amazing ROI. You can start the process for your patient same day and deliver a tooth replacement option for your patient in the same visit. Whether you are designing yourself in exocad or whether you're outsourcing to Lux Cloud, you still take advantage of the one-click and print workflow and then deliver to your patient. So ultimately, what this creates for us is, again, an end-to-end dentist and team workflow where you can scan or your clinical team can scan. You can outsource this design or you can design it on your own in exocad or 3Shape. And you can print your restoration, you can print your removable or your fixed prosthesis, and you will deliver this to your patient same day. This is a Nesbit that was created for a patient same day. This is a fabulous opportunity for same-day dentistry for a patient to provide them a chance to leave with a tooth when they initially came in thinking that they were not going to leave with a tooth. The indication you'll see here is a full partial. So we replaced multiple teeth for this patient utilizing 3D printing technology. So where do you start? I would challenge you to evaluate your current systems and see where digital workflow can truly be incorporated. And once you have seen where you can incorporate digital workflow into your success, take it a step further. What can you 3D print? If you are mostly doing removables, great, you have a place here. If you are mostly doing fixed prosthesis, great, you have a place here. If you're mostly an orthodontic practice and you're doing aligners, you also have a place here. There are a multitude of expansive opportunities when you invest in digital dentistry and when you take it a step further and invest in 3D printing. So if you are ready to future ready your practice, I hope that you will take the advice that has served me well, and that is to invest in digital design, invest in a digital workflow, and invest in 3D printing in your practice. And I open the floor for any questions that anyone may have.